Last week we were in the operating room doing a aortic valve replacement with Dr. Rizik and Dr. Riley, and I'll tell you, it was amazing to see this go on. And let's remind people of the difference between the replacement and the repair. And we keep on doing that because a lot of people don't understand that.
There are some times when a valve has degenerated and we can perform a repair procedure. We don't remove the valve, we don't put a new valve in on top of it. We can do that surgically. Dr. Riley repairs valves all the time. We can do that with catheter-based techniques in certain circumstances. This was more akin to when surgery is performed and actually a new valve is implanted. In the case of surgery, Dr. Riley removes the old valve and puts in a new valve. In the case of a catheter-based technique that we perform together, what happens is a new valve is implanted right on top of the old valve, and I always use the expression, we wallpaper over it.
Yeah, Dr. Riley, we got to talk about this procedure because what were we saying, probably almost 10, 15 years ago, it would be cracking open the chest to perform one of these, and now it's going through the groin, and that's what's so important about this new procedure.
So the transcatheter valve procedure was approved in 2011, so it really has been 10 years. And before that, you're right, for the 70 years prior to that, it was open chest surgery. We did evolve from a full cracking open the chest or open chest surgery to minimally invasive procedures where we make keyhole or port access incisions. So it is less invasive these days, but now we have the option of all three different methods.
And I think when we get together, so Tuesday morning from 7 o'clock to 8 a.m., we sit together with the entire team and we go through patient one at a time and we make those critical decisions. Is this a patient who is young and may otherwise be best served with a surgical valve? Is this a patient that we would use a catheter-based valve? And every patient is looked at and vetted very specifically, and we tailor the therapy to the patient needs. And that's the beauty of this heart team.
Yeah, and that's the whole thing right there, team, because as we were talking before, usually it was just Dr. Riley off to himself and Dr. Rizik off to himself.
Question.
But today you guys were together, which was so important.
Yeah, Bob, I think that's one of the great things that these catheter-based techniques have helped to spawn is a team approach. We're still in the embryonic stages. We're still in the early stages of understanding everything we need to understand about who gets surgery, who gets catheter-based valves, that the catheter-based valves the technology is moving at an incredible, almost meteoric pace. But when this patient wakes up, he's going to have a brand new valve and 90% chance he'll go home tomorrow.
Right. I think one of the most important things for patients to understand when they are at home trying to figure out this is, when you have the disease, you need to come to a center where you have options and not come with an expectation of one option versus the other, because you may not be a candidate for open heart surgery, you may not be a candidate for a transcatheter procedure, and that's why we have a team of experts to do that.
Yeah. Also, I have to say the technology is amazing because you guys are looking at monitors thanks to a wonderful company that has worked with you doctors to help you do this surgery.
Siemens, you can't say enough about the partnership that we have with Siemens. Not only the partnership on a very personal level, but their technology is so spectacular. You saw Dr. Burke using Siemens echo equipment to give us imaging. Dr. Riley and I were using Siemens X-ray equipment. I mean, it is really, really very refined technology and allows us every chance to succeed.
Yeah, and of course the device that put the aortic replacement in, that's another amazing team that you work with.
The Medtronic team is just fantastic. The device is so easy and comfortable to use. You saw that we were deploying the valve without any stress. The patient was never unstable, no
Our
rush.
conversation was casual.
And we repositioned the valve.
And we repositioned the valve.
Yeah.
And that's the thing I love about that valve type that we use. If you're a golfer, you'd call it a mulligan. You get a second chance to put it in.
Yeah, it's amazing. All right, let's go ahead and give the tips that you love to tell people so you don't have to see them in the operating room like
Okay,
this.
so
and that is?
Eat right, exercise regularly, see your doctor on a regular basis, and never, ever, ever pick up a cigarette. There's no amount of tobacco use that in my opinion, is safe.
There you go. Doctors, thank you very much. And if you did miss the procedure, you can go to aztv.com/procedure and see all three and, of course, Dr. Rizik and my talks about the different surgeries.